Assalamualaikum warahmatullahi wabarakatuh. I am Hanis Fatini binti Ahmad Kufrawi from Group 20, and today my group will be presenting and sharing about Maqasid Syariah in healthcare. So the objective of this topic is to define Maqasid Syariah, to describe the classification of Maqasid Syariah, to implement Maqasid Syariah in healthcare, to explain the principle of Islamic ethics in healthcare aspect, and lastly to promote Maqasid Syariah in healthcare among Muslims. So what are we going to share to you guys for today is, first we would like to define what is Maqasid Syariah and tell you guys what are the brief classifications of Maqasid Syariah, and next we go to the content, which is we would like to tell you how is Maqasid Syariah implemented in healthcare, and what are the principles of Islamic ethics in Maqasid Syariah in the aspect of healthcare, and lastly is how can we promote Maqasid Syariah in healthcare among Muslims. Firstly, what is Maqasid Syariah? Maqasid Syariah is actually the legal philosophy of Islamic law, a study built as a fundamental part in Islamic legal studies to rationalize the application and execution of Islamic law. The term maqasid itself derived from the Arabic word qasada, which translated as to aim, which technically refers to the purpose, objectives, or intention behind something. And next is Sharia, which originates from the root word of shara'a, which means a straight path to be followed. It can also be translated as laws, which govern a wide scope of rule, such as the rules of performing daily rituals and religious practice, and the rules of political and public administrations. Putting both of these maqasid and Sharia together, Ibn Ashur had defined Maqasid Sharia in its technical sense as a science that aims at knowing the purpose of Islamic law. There is actually three classifications of Maqasid Syariah, which is the essentials or necessities al-daruriyat, the needs al-hajiyat, the complementary al-tahsiniyat. These three combined together are constructed as an approach which includes human interests and benefits as the basis reasoning in the principles of jurisprudence, as some scholars actually believe that human interests and law are connected together. Okay, moving on. So for the first classification, which is the essential or necessities al-daruriyat, these are actually matters that are necessary for the people to either conduct their religion or worldly affairs, where if we neglect this, it can lead to a full destruction or disruption of life. There are actually 5 principles under the essentials, namely protection of religion, al-din, for example, defending Islam against an enemy's attack, protection of life, protection of dignity or lineage, al-'id, for example, is building a hospital, and next one is protection of intellect, al-'aql, and the last one is protection of property, al-mal, for example, or for instance, distribution of wealth in fairly manner through zakat. All these 5 values are considered essential for human rights. Thus, safeguarding these fundamental values are required, and measures should be taken to remove any obstacles in their executions. Okay, so for the next one is the needs, al-hajiyat. Al-hajiyat are things concerning the needs of humans to conduct their affairs, in which it helps the executions of the 5 essentials mentioned prior. Disregarding it will lead to hardships and inconveniences to the individual or community. An example of the needs is legal excuses, namely what we call in Islam is rukhsah, in respect to their ibadah, which are given to some people in certain set of conditions, such as the sick and the travelers. For example, sick people, one that are unable to perform prayers while standing, are permitted to perform it while sitting. If still unable, they can perform it while laying down in a sleeping position. These needs were granted to ease the completion of the essentials. And the last classification, which is the complementary al-tahsiniyat, which as its name suggests, is a matter in regard to the acquisitions of that which is desirable or of interest. For example, is maintaining the appearance and cleanliness while performing an ibadah. Removing the complementary might just cause discomfort in life, but will actually not disrupt one's normal life. Nevertheless, Islam teaches us to pursue these goals in correct manners. These three classifications are branches of Maqasid Sharia, and it needs to be taken into account when rationalizations of the application of Islamic law is conducted. This classification is made to attain Maqasid Sharia in achieving its goal. One of them is to prevent harm and secure interest.
Assalamualaikum, my name is Madiha. So next I will be explaining about the concept of Maqasid Sharia in the healthcare settings. So Maqasid Sharia is actually a very comprehensive concept because it focuses on the harm reduction and also the promotion of well-being in life, in which it is closely correlated with the healthcare settings that deal with human physically and also emotionally. So first of all, the healthcare sector is greatly associated with the principle of Maqasid Sharia, which is the protection of life, because any disease or injuries should be treated immediately to the best of ability to prevent further complications that could lead to the life-threatening condition. So it is actually reported by Abu Hurairah that Messenger Sallallahu Alaihi Wasallam said, God has not sent down a disease without sending down the remedy for it. So whenever we feel like we feel sick or we have a disease, we should seek for the treatment by going to the nearest clinic or maybe the pharmacy. And there is actually a heated argument about the right of abortion or the right of the child to live in the Western countries, especially because it concerns about the pro-choice and the pro-life, and it actually concerns about the act of induced abortion in which the mother willfully abort the child. And in Islam, it is actually strongly prohibited because it is actually causing the loss of the fetus. It means that we fail to protect the life of the child, and it is only allowed for a few cases in which the pregnancy could impose a threat to the mother's life or there is the fetal deformity in the pregnancy. So the decision actually is based on the principle of Darar al-Aqaf, in which it is the principle of committing the lesser harm, supported with the al-yakin la yazalu bi al-shak, which is the principle of certainty which cannot be overruled by the doubt. So the induced abortion could only be done under certain circumstances because, as mentioned in Surah Al-Isra, verse 33, Bismillahirrahmanirrahim, وَلَا تَقْتُلُوا النَّفْسَ الَّتِي حَرَّمَ اللَّهُ إِلَّا بِالْحَقِّ, and do not kill the soul which Allah has forbidden except by right. So next one is the protection of lineage, and it is strictly for married couples who are unable to conceive child naturally. So they are encouraged to opt for various fertility treatment that could get them a higher percentage of getting a child. Among the treatment that they could try include the in vitro fertilization, IVF, and also the sperm retrieval. Aside from that, we as Muslims, we should be mindful that there are certain fertility treatment that could not be done by the Muslim, such as the sperm or egg donation, the surrogacy, and also the gender selection, because some of these treatment, they could question the origin of the child. It could violate the integrity of the religion because it can cause the genetic confusion, and especially in the family ties. And there is actually an interesting story in the Quran which involved Prophet Zakaria, in which he was bestowed a son named Yahya at the age of 19, even though his wife are said to be barren. And it is actually an ayah that encouraged the married couples who do not have child yet. So it encouraged the couple to always to always ask for a child from Allah. And as stated in Surah Al-Anbiya, verse 89, this ayah say Bismillahirrahmanirrahim, wa Zakaria iznada rabbahu Rabbi la tazarni fardan wa anta khairul warisin. And remember when Zachariah cried out to his Lord, "My Lord, do not leave me childless, though you are the best of successors." So married couples should always seek for the fertility treatment so that they will have the next generation of their family. Lastly, the healthcare sector actually plays a big role in protecting the intellect of the human, because these days we know that there are a lot of mental disorders that affect us, and one of 3 people they are actually affected by the mental disorders. And the most common type of disorder that we found includes depression, bipolar, and also anxiety. And this could be due to the huge burden that we experience in this fast-paced era. Maybe we have a lot of things to be done. So the healthcare team should plays their role in this case, in which they should protect the intellect and life of the mental patients who might not be able to think rationally, by assisting them accordingly using the pharmacological or non-pharmacological treatment, because it could help them from making any attempts that could cost their life, because they might not be able to think rationally and might mischarge because they are surrounded by the negative vibes at that time. So the healthcare team should be assisting them to lead them from being disarray. So there is an ayah from Surah Fatih. Bismillahirrahmanirrahim. Ya ayuhan nasu inna wa'adallahi haq fala tughurrannakumul hayatud dunya wala yughurrannakum billahi ghurur. O mankind, indeed the promise of Allah is truth, so let not the worldly life delude you, and do not be deceived about Allah by the deceiver. So by doing the responsibilities as a healthcare team, we could protect the Maqasid Sharia and prevent Muslim from doing any acts that could violate the divine law that was set by Allah SWT. So next, I will pass on to the next presenter. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Siti Nuraina Nadira binti Mazat. So I will continue the presentation today with the part of principle of Islamic ethics and Maqasid Sharia in the aspect of healthcare. The application of Islamic ethical principles to medical procedures in order to promote health and save life is the cornerstones of the Maqasid Sharia principle in healthcare. It is urged for all the healthcare professionals to maintain high standards in their work by adding virtues like compassion, kindness, honesty, and reliability. Furthermore, intended benefits and potential harms, as well as guaranteeing adequate information and conformity to established healthcare standards. Therefore, Islamic ethics guided by Maqasid Sharia focuses on values like respect for autonomy, beneficency, and also justice. So I will explain more details about these 3 values that will be focused on the principle of Islamic ethics and Maqasid Sharia in the aspect of healthcare. First of all, the respect for autonomy. Autonomy emphasizes the importance of respecting patients' right to make informed decisions about their own healthcare. It is the base for all dealing in healthcare facilities. Islamic law takes into account the needs for autonomy and agreement between patients and medical professionals. It encourages patients to take responsibility in their treatment plans. However, if it contradicts the principle of Maqasid Sharia, the medical professionals should not follow the free choice of the patients. In the Islamic tradition, patient autonomy cannot justify medical practices that go against the sanctity of life, like suicide, abortion, and also cosmetic surgery. While respecting patient autonomy is important, it cannot override the principle of preserving life, because no one has autonomy to take a life, except in the case of retribution for murder. So hence Islamic medical ethics uphold patient autonomy but within the boundaries of preserving life and adhering to Allah, which is our divine commands. Okay, so next we move on to the other value, which is beneficency. It is also the principle of Islamic ethics that can relate in healthcare settings. The beneficency is also known as ihsan, or the duty to do good. The principle of Islamic law, which include preventing harm and securing interests, are intimately related to beneficency within the context of Islamic ethics. While prohibiting actions that could be harmful or unfair, this ethical guideline promotes deeds of kindness, compassion, and also generosity. Healthcare professionals are urged to get along with the patient's best treatment, making every effort to treat them with compassion and to minimize their suffering. As the Prophet ﷺ stated, there is no disease that God has created except that He also has created its treatment. It can prove that a sick person should seek treatment. This is in line with the preservation of human life and welfare. Finally, but just as importantly, Maqasid Syariah is essential for highlighting justice and honoring people's rights, especially their freedom of religion. This idea has an impact on the creation of Sharia-compliant medical facilities that attend to the spiritual requirement of their patients. According to Maqasid Syariah, justice includes guaranteeing equity, fairness, and also the defense of fundamental rights. This translates in the context of healthcare into offering treatments in line with Islamic law, honoring patient faith, and establishing an atmosphere that promotes their spiritual health is needed. So, healthcare facilities that adhere to Sharia law are built to meet patients' religious requirements and provide treatments that are consistent with Islamic principles. Overall, by encouraging respect for patients' religious rights, making sure that healthcare services are delivered in a way that maintains Islamic values, and creating an environment that supports patients' spiritual well-being. So, this Maqasid Syariah emphasizes the significance of justice in healthcare. This method not only improves the standard of healthcare, but also make the healthcare patient-centered and comprehensive. Okay, so that's all for my part. I will pass to the last presenter for the last part, which is the suggestion. Thank you.
My name is Radatul Arabia, and I will continue the presentation by describing on suggestions on how to promote Maqasid Syariah in healthcare among Muslims. So, as we all know, the main objectives of Islam is preservation of life, faith, intelligence, prosperity, and also offsprings are also encapsulated in Maqasid Syariah. So, to ensure and guarantee that our healthcare delivery system is in line with Maqasid Syariah's values and goals, here are some suggestions on how to promote Maqasid Syariah among Muslims. So the first suggestion is by giving educations and awareness campaign to as many people as possible. So the main objectives of this step is to develop cultural competency and sensitivity in healthcare professionals such as physicians, doctors, and also nurses in the healthcare settings. We can also provide them with a greater grasp of Islamic beliefs and values of Muslim patients. For example, we can organize events like meetings, seminars, or posting things in the internet that can operate as a forum for the discussion of people. In addition, the second step that can be done is by giving specialized training programs to medical personnel. So, the objectives of this step is to equip the healthcare professionals with the knowledge and also skills that is necessary to navigate when there is ethical dilemmas within the framework of Maqasid Syariah. For example, let's say that a patient comes to you and she wants to do abortion. So this is where your knowledge and skills are tested. So as we all know, patients have freedom in making decisions or autonomy, but honoring patient freedom should never encourage them on self-destructive behavior such as euthanasia and also abortion, like I have just mentioned, because no one has the right to take another person's life or even its own. So, in this case, we can say that patients' opinion regarding medical treatments should be accepted and respected, provided that they do not involve self-harm. The next suggestion is by doing a collaboration with academics and religious authorities. As we all know, religious leaders are very influential or are very essential in influencing community attitudes and behaviors about healthcare. So it is a wise step to collaborate with them. And the last suggestion is by doing more research and development or R&D, so that our healthcare system can always remain up to date with the latest ethical opportunities or technologies that is provided in the healthcare setting. In summary, encouraging Maqasid Syariah in Muslim healthcare necessitates an integrated approach that includes many things such as research, collaboration with influential leaders, teaching, and also training. Healthcare systems can make sure that they do not only meet the patient's clinical demands but also respect their moral and spiritual by incorporating Islamic ethics. So, healthcare professionals can work towards a more moral, compassionate, and inclusive healthcare system that respects both the dignity and well-being of every person in line with the Islamic teachings.